while 16 have reported the one first identified in South Africa. Several hospitals, schools, and long-term care settings have reported outbreaks involving new variants of concern. Lockdowns introduced to limit the spread of the virus, particularly the more transmissible new variants, have resulted in a decrease in new cases across the region. 30 countries have seen a significant decrease in 14-day cumulative incidents. This is 7 more countries than 2 weeks ago. Yet, transmission rates across Europe are still very high, impacting health systems and straining services, making it too early to ease up. Pushing transmission down requires a sustained, consistent effort. Bear in mind that just over 3% of people in the region have had a confirmed COVID-19 infection. Areas hit badly once can be hit again. Not a single community nor individual have been spared from the consequences of the pandemic. More than 700,000 Europeans have lost their lives to a virus that has had a brutal impact on our economies, our mental health and education, our private and professional lives, our relationships. Last week alone, deaths continued to plateau at record levels with over 38,000 new deaths reported. To the families and loved ones of those who have lost their lives to this disease, I offer my deepest condolences. While breaking transmission change is a clear priority, we are also addressing the effect on mental health. Mental illness is taking its toll, both on those who were already at risk, as well as on those who have never sought mental health support before. The International Labour Organization found that the pandemic has meant that half of young people aged 18 to 29 are subject to depression and anxiety, and up to 20% of healthcare workers are suffering from anxiety and depression. Poor mental health has become a parallel pandemic that WHO Europe is determined to address with a new mental health coalition aimed at ramping up support and guidance to every country. Some tough questions have been asked of our leaders over this past year. To the European health authorities that have taken timely but painful decisions and managed to reverse the trend, I commend you for your resourcefulness and actions. Empowering health leadership in countries, especially in times of crisis, is a priority for WHO Europe. Let us not forget the lessons we have learned so harshly. Opening and closing, locking down and opening up rapidly is a poor strategy. The introduction and gradual lifting of measures based on epidemiological criteria remains our best option to allow economies to survive and minimize collateral effects. Our approach must be measured, it must be restrained. We need to stay patient. It will take time to vaccinate against COVID-19. To the millions of you in the 25 European countries that are currently in partial or full nationwide lockdown, whose freedom of movement is restricted, I am fully aware of the sacrifices you have made. I too feel it in my family, my community, and my workplace. In the face of new, more transmissible variants of the virus, we will need to keep our guard up. This is the time we must draw on every reserve of patience and resilience to tolerate and adhere to the necessary measures that protect our health systems from collapsing under waves of a more transmissible virus. Stay positive, stay healthy, stay connected. Thank you.
Thank you very much, Regional Director. I'm going to move straight on to the questions, and thanks again to our panel, Siddhartha and Katie, for joining us alongside the Regional Director today. I'm going to go straight over to Sanatat Moldova and Irina Papuch, who has sent us in a couple of questions. The first is for you, Siddhartha. I think the second is for Katie. The first, Siddhartha, what is the evolution of the supply of vaccines to the Republic of Moldova? Can you tell us how many doses will Republic of Moldova receive, and which vaccine? Pfizer, BioNTech, Moderna, or others? Will the other doses be negotiated through COVAX, or will the countries have to negotiate alone with the manufacturer? Siddhartha, please, and thank you for your question, Irina.
Thank you, Irina, for that question. I hope, Rob, you hear me well. Thank you. So, as a part of the global effort made by WHO, CEPI, and Gavi, the access to vaccine has been one of the principal elements towards ensuring equitable and fair access to the vaccines, as you have also heard from the regional director just now. Within that concept, what we are aware, the Republic of Moldova is an integral part of this COVAX mechanism, where Moldova will get access to the available portfolio of vaccines which are within the COVAX facility. Whether the vaccines which will be made available to Republic of Moldova and other participating countries and economy within the COVAX is dependent on few elements. One of the principal element of that is a recognition or of the emergency use listing of a vaccine by WHO. This indicates that WHO would have had reviewed the safety, the efficacy, and quality of vaccine which will be provided to the participating countries and economy by the COVAX. This is critically important. While we all are expecting the access and availability of a vaccine in a country, is paramount that the vaccine which is being made available to a participating country or economy in COVAX is safe, effective, and of quality. The question about how many doses of vaccine that will be available to Republic of Moldova is also dependent on a couple of factors. Number one, the production volume of the manufacturing capacity for each of these vaccine developers and the vaccine manufacturers, but also is dependent on the in-country processes that are being laid down by the Ministries of Health in ensuring that the vaccines can reach. So it's a interdependent factors, number one, on the use of emergency use listing of the vaccines by WHO, plus also the manufacturing capacity of the manufacturers, plus the in-country import and other factors which will play an interdependent role in this whole process. Thank you.
Thank you, Siddhartha. A second question from Irina that I'll pass to you, Katie. What are the solutions the WHO recommends for low-income countries that cannot do genome sequencing to detect the new SARS-CoV-2 variants? The VOC 2020-12/01 variant is already widespread in Europe. Katie, please.
Thanks, Rob, and thanks, Irina, for the question. You're absolutely right that as these variants of concern spread, and if they're more transmissible and fitter to be spreading in the human population, they will spread, and there's not much we can do about that as long as transmission is occurring at the high levels that it is occurring. So the main point here is that we really need to bring down transmission everywhere, and that will really be the best way to preempt the spread of any new variants. The second point is that whilst we know that these variants are more transmissible, what we also know is that the tools that we have at our disposal to control COVID work against these variants as well. So whether or not a country is able to really identify these variants to the extent that some high resource settings can do, it doesn't matter in terms of the public health measures that need to be put in place. The ones that we have at our disposal now will also work against those potentially more transmissible variants. Now, when it comes to whole genome sequencing, which is at the moment the way that we can identify these specific variants as they occur, some countries have the ability to do that, and other countries have less of a capacity. It's a high resource requirement. It takes a long time to do the sequencing, and it takes a lot of effort and resources that are dedicated to that. And some countries may choose to focus more on the PCR testing and the molecular testing that is able to identify people with any forms of the virus. WHO does have ways to support countries that would like to increase their whole genome sequencing. And we have guidance that we've recently issued for countries to do that locally. And countries can look at their own domestic resources, including those that are available from the private sector or for academic groups. But we also provide some support through our reference laboratories for COVID-19 in the region. There's a small capacity that they have in helping countries sequence virus isolates. So if countries wish to, they can come into contact with WHO and we can help in the shipment of samples. And we do that already. And we're also looking at specific countries outside of the European Union that already have capacities within other disease programs, such as their tuberculosis programs, and where we can provide additional support in creating sub-regional hubs where we can scale up the amount of whole genome sequencing that we're doing. So thanks for the question, and more news in the coming days, but please do get in touch with WHO.
Thanks very much, Katie. A question next from Tony Kerridge for the Regional Director. We reach 1 year, the 1 year marker, which you just referred to in your statement, Regional Director. We reached the 1 year marker since the coronavirus arrived in Europe. Looking back, what should Europe and WHO have done better?
Thanks, Tony. Starting from the positive, I think we must admit that in every country we have seen communities really pulling together. I mean, demonstrating solidarity, resilience, often most visible at the local level. Certainly, the what I call cross-border or international policy coherence could have been better. And I think we're arrived at a critical moment now also with vaccines, that we don't see the same situation as we saw in the beginning with the personal protective equipment. So it's a big stress test for solidarity that we're standing for once again. Of course, I think we all agree we have seen issues with the failure of the market to provide supplies, the need to really upgrade, nurture our health workforce, the unsung heroes of this pandemic who have been working for a year 24/7 and still is very much a top priority. And looking to the future, it comes back to the basics, that the European region needs a strong public health system with a strong primary health care. And that's what we are going to bring to the Region Committee or Governing Body Board in September, the 53 member states, a roadmap on reinventing primary healthcare and public health based on the pandemics. And ultimately, that health has to remain at the top of the political agenda, which is the purpose of the Monti Commission. Thank you.
Thank you very much, Regional Director. Right, I'm going to go to the journalists that are raising their hands online. First, over to the Washington Post, Michael Birnbaum. Michael, I understand you've got a question on schools. Michael,
yeah,
please go ahead.
Thanks very much. I wanted to ask what the impact is of the mutations on your guidance for school closures. I know that fundamentally you're saying it doesn't change the calculation, but I'm wondering if, in the context of pushing down overall community transmission, whether you think that it might make sense to close school, or how your guidance is changing, and whether schools need to close more quickly than they once might have before the spread of these mutations. Thanks very much.
Thanks very much, Michael. I'll send that across to you, Katie, if I may, for a response. Thank you.
Thanks, Michael. It's a great question. There are actually several things to unpack there, because we know quite a lot about what happened with the emergence of the variant of concern in the UK and how schools were implicated in that. And it's worth just re-emphasizing that at that time, the UK had a range of restrictions in place, save the functioning of schools for younger children, and those schools remained open at the time that this particular variant of concern started to spread in the community. And what was found there was that without the emergence of that new variant that has this higher level of transmissibility, the schools may have remained open, keeping the reproduction number below 1. But this increased transmissibility meant that having the reproduction number increase, keeping the schools open, kept that reproduction number over 1. And that's how this acceleration occurred. And that's also why we saw in the initial stages of the emergence of this variant a higher number of cases among children, which was then corrected once those schools were closed and we saw the variant spread among all age groups as other lineages do. So in terms of the question, there is no change in the guidelines. However, depending on the context of the country, depending on the levels of transmission in those settings, closing schools may, unfortunately, have to be that extra step, that final push to bring the reproduction number under 1 and be able to control transmission. But what I'd say is we should look at transmission a little bit like stopping a fast-moving train. And when transmission is very high and the speed of that train, that spread is very fast, it's going to take a lot. And as that train, the transmission starts to slow and slow and slow, that's when we can start to be more specific, start to be more efficient in the way we control the spread of the disease. And all of that will remain the same. So that's just to say that variant or no variant, the ambition should be to keep schools open and bring transmission down.
Thank you very much, Katie. I'm next going to go over to Gunilla van Hull, who joins us from Svenska Dagbladet. Gunilla, the floor is yours. Thanks for joining us again.
Yes, can you hear me?
We can. Please go ahead.
Thanks. I have a question on vaccines because there are delays in vaccine delivery from AstraZeneca. About 60% of the doses are not there. This has created a big controversy and tension between AstraZeneca and the EU. And it also, governments are now fearing this will have a big impact on the vaccine campaigns. They will be very much delayed. What are your concerns of the effect this delay will have on the spread of the virus in Europe? Perhaps specifically on the spread of the new variants. Thanks.
Thanks very much. I think 2 parts to that question. I think maybe Siddhartha first on the vaccine supplies, and then I'll go to Katie to elaborate on the second part of your question regarding what the potential implications may be. Siddhartha, please.
Thank you so much. Thanks, Gunilla, for that question. Indeed. So as part of the, since the start, I think if you would remember, the discussions around ensuring a timely availability of the vaccines within the entire context of equitable and fair access was outlined by WHO quite profoundly. Within that concept was around a responsibility of everybody. The vaccination is sort of a well-running apparatus. Each part of that apparatus need to function. The availability of the vaccine is linked to the production volume of the vaccine by the manufacturer. And hence, this entire COVAX mechanism, where both the vaccine manufacturers, through the engagement of the research and development of the CEPI, and Gavi, which together with WHO, provided a mechanism for the research and development, the issuance of the safety and efficacy process by WHO, all was put together. Within that process, yes, now we do hear, and we have heard from AstraZeneca and Pfizer as well about the delays of their manufacturing units. And I think we all should be engaged in this whole process so that the shared responsibility between the government, the public, and the private enterprise all can come together. Nobody can deliver this entire scale of vaccination alone. And I think everybody does and should have a responsibility in engaging and also ensuring that these challenges which are being faced in this initial teething time of vaccine rollout and production can be addressed as we move forward. So I think the other part which I would also emphasize here and you have heard the regional director in few of his past press conferences say that availability of the vaccine is a part of that component, but ensuring that the countries are prepared when the vaccines come will play a big role in ensuring whenever the vaccine is available, it reaches out to the beneficiaries for whom these vaccines are destined for. And I think that production, yes, will have a part in the rollout, but we are also should be aware of the fact that the vaccines, when it reaches to a country, reaches out, the system is abreast, system is in our front in ensuring that the vaccine flows and reaches out to the beneficiary for whom these vaccines are being brought in. So for the rest, I think I will pass it to Katie then.
Please,
Thank
Katie,
you.
please.
Thanks a lot. And two points to address the transmission component of your question. First of all, focusing on countries where vaccination is already happening. Transmission of COVID-19 pretty much in all countries and certainly across the region is being driven by groups of populations that are currently not being vaccinated. So only about 20% of the cases being reported in the European region at the moment are among those older age groups that have been prioritized for vaccination. So there's even with slows or hiccups in the current manufacturing processes for those priority, even once you have complete coverage in those priority groups, that will still not have a significant impact on the transmission of the virus at the moment. But then more broadly, and when we do get into those other populations, there's the question of equity. And this is where I think we have to be really aware that we need to move across borders, addressing all populations in an equitable and progressive way. And this is important, especially because of these new variants of concern. What we see is if you leave areas of the world where transmission is happening at high rates and we're not controlling this and bringing this down, this will provide the types of transmission and the conditions for new, more potentially transmissible or more potentially severe variants of concern to pop out. And those could, in future, pose very significant challenges to the tools that we have, including diagnostics, including the vaccine. So it's really in our interest to move ahead with this equitable and fair distribution that COVAX provides. And it's in everyone's interest to do so, no matter how you cut the cake.
Right, thank you very much. Now, while we're on the topic of global vaccine supplies, I'll go over to Angela Dewan from CNN. Angela, please, your question. I believe it related to global vaccine supplies.
Yes, thank you so much. Just related to the previous question, we've seen some tensions rise between the EU and the UK recently over these limited supplies. We know that the UK had asked in its contract with AstraZeneca to supply that country first with doses made within the country. I'm just wondering what your thoughts on that are. Should countries be making these deals with drug companies to supply their people first, when I think, the spirit initially in talking about this was that the most vulnerable people around the world would be prioritized, not only within countries. And just related to that, I wonder too, if you think these contracts or details about each country's supplies should be made publicly available and transparent. Thank you.
I'll ask the regional directors to make a comment on this, and then we'll go over to Siddhartha Datta. Thank you, regional director.
Thanks, Angela. Definitely, WHO upholds the principle of the solidarity and leaving no one behind. From a moral point of view, but also from a global security and a regional security point of view, that no one is safe until everyone is safe. Having said that, a solidarity does not necessarily mean that each country in the world starts exactly at the same moment, right? And it's up to the country then to make the plans. But I also would like to mention here that we don't doubt that the manufacturers and the producers are also working 24/7 to bridge the gap, and that I would remain confident that a delay which we're seeing now is going to be made up by extra production in the near future. Thank you.
Siddhartha, any points from your side that you'd like to add to that?
Yeah, thank you, Rob, and thank you, Angela, for highlighting that question. And I think I would try to have 2 points. One is the unprecedented research and development effort being made by the global community from where we were 1 year back has to be acknowledged, as you also have heard that from the regional director's initial address. This production hindrances that we have seen is also bringing in the issue of protecting their population first by each of the countries, which you have heard the regional director and earlier from the director general about ensuring that because infectious disease know no borders, we have to ensure that everybody gets access to this vaccine. Within that concept was protecting the vulnerables first. Vulnerable, the healthcare workers who are at high risk or at very high risk of both acquiring and transmitting the infection, and also the elderly population groups or people with comorbidities. Within that process, they ensuring the population within each of the countries are protected with the available vaccine need to continue while waiting for the rest of the doses to come in. These production instances at the first initial teething time need to be addressed, and I think we need to learn as we start rolling out the vaccine with the available number of doses, and then be prepared as the higher volume becomes available in any of the countries. I think these lessons learned will be helpful for both the early implementers and also for the other countries who are who will be receiving the additional doses or the destined doses very soon. Thank you.
Thank you, Siddhartha. Next, to go over to Jamie Keaton, Associated Press. Jamie, welcome back. Floor is yours.
Thank you very much, Rob, and nice to see you all again. I wanted to just follow up on some of the comments, and I'd really like to hear it from Dr. Kluge, if possible, about this sort of vaccine nationalism that is happening within Europe. And particularly, what can you do about it at WHO Europe? What specifically are you saying to government leaders and EMA, if you're communicating with them, about what can be done to sort of assuage this tension? And just if I could follow on that a little bit, is the concerns about the age limit that the AstraZeneca vaccine may be set upon, the age of the recipients. If you could tell us how important that is. Thank you so much.
Thanks very much, Jamie. Regional Director.
Yes, welcome back, Jamie. So what we're telling indeed, because the telephone line is very hot, as you can imagine, but the leaders and the prime ministers, and it's first and foremost that we stand by them, and we do understand the situation. Solidarity is key, but we also have to be pragmatic, because we could anticipate, right, that there will be some tension between the principle of international solidarity at one hand, and then the national responsibilities by the leaders in a particular country to take care of your population. I think it's a matter of timing. I was speaking 2 weeks ago with the President of the European Council, Mr. Charles Michel, Vice President, regularly with the Health Commissioner, Dr. Kyriakides, also in the East, and there is a general awareness, there is a general goodwill and understanding that no one is safe until everyone is safe. But the reality is that for the time being, there is realistically a shortfall of vaccines. We are also working very hard to get the COVAX operational, because that would be a great help. So I think there is we have to come to a further dialogue on the operational details, and that's what we're trying to work on, including with our partners from UNICEF, and get the countries ready, because that's another message to the leaders, that the countries have to be sure that they are ready to receive the vaccine, because there is so much attention to the vaccine. There are other issues to be worked out, like the cold chain, indemnification, liability, legal issues, etc. I think that would be the crux from our elevator speech. Thank you.
Thanks very much, Regional Director. And the second part of your question relates to age limit with the AstraZeneca vaccine. Thank you, Jamie. I'm going to pass that to Siddhartha. Siddhartha, did you catch that question from Jamie?
Yeah, so Jamie, you talked about the age of the recipient. This is linked to what you are, I think what you are trying to indicate about the AstraZeneca receipt, who should be receiving that vaccine. If that is the question, the WHO and including the European Medicine Agency is waiting for AstraZeneca to share the clinical trial results and other dossier documents, as we say, where they will be reviewing all the available evidence from the clinical trials. And then obviously the strategic advisory group of experts will be providing its interim recommendations to WHO and to the member states on the use of the vaccine.
Okay, thanks very much, Siddhartha, and thanks again, Jamie. I'm going to go now to a couple of questions that we've received in advance before I go back to the journalists that are joining us online. This question is from Judith Cernianski from Club Radio Hungary, and it regards the Sputnik 5 vaccine. How effective and reliable is the Sputnik V? Can the Hungarian government vaccinate the people with this Russian vaccine? I'll go to the regional director for a comment on that. Thank you, regional.
Right. Thank you, Judith. So I think this question came also earlier. WHO has been following the process in the COVID-19 vaccine development very, very closely, obviously, since the very beginning. And we continue to review the clinical trial data as they are submitted by manufacturers, and we encourage all manufacturers to do so as swiftly as possible. Once we get that, we do share the information on the demonstrated safety and efficacy of each candidate vaccines. To the Sputnik V, there was an important meeting about a week ago between the Russian Investment Fund and the WHO headquarters, the Department of Pre-Qualification, to speed up this matter. And I myself had a very productive talk with the Russian ambassador in Copenhagen yesterday, confirming that the necessary additional information and trial data are on its way to Geneva. As to the Hungarian government, so each country is sovereign and has the right to choose the tools and the products it considers to be best suited for its population. And it's important, of course, that the in-country regulatory process meets the high standards of science and ethics as outlined in the WHO guidance around the exceptional authorization of vaccines in emergency context.
Thank you very much, Regional Director. Katie, I have a question to you from John Goranitis from Inside Story Greece. A few days ago, Montreal Heart Institute announced the results of a large clinical study into the effects of colchicine in the prevention of complications caused by COVID-19. Immediately after the announcement, Greece and Cyprus included colchicine in their treatment protocols, even for non-hospitalized patients. Do you have any comments on that? Do you also have any updates on other outpatients treatment protocols? Katie, please.
Thanks, Rob, and thanks, John, for the question. Colchicine is a well-described drug regularly used for common ailments such as gout. And it is indeed, due to its anti-inflammatory properties, under investigation by a number of groups. In fact, probably over 25 clinical trials are looking at this particular drug. As you note, the Montreal Heart Institute has issued a press release and a paper that links to some of the results of their randomized controlled trial, which was the largest that we're aware of for this particular drug. And WHO is waiting for the full assessment report from that trial to be included in our own deliberations and assessments of the various trials and their results. And so we would, on the basis of the full report and the full findings of the trial, look at updating our living guideline for clinical management of COVID-19, as we do on a regular basis. And just over the past couple of days, we've issued the most recent update to that particular guideline. So that's something we do on a regular basis, but we haven't yet had the opportunity to look at the full trial results. In the context of countries that decide to move forward with incorporating these drugs into their treatment protocols for COVID-19. We would recommend that if countries do so, that they do it in line with emergency use monitoring protocols for drugs under investigation for COVID-19. And there are specific set of protocols that the WHO recommend in that context. Thank you very much.
Thank you, Katie. Next, I'll go over to the Polish press agency and Oskar Gozinski, who wants to ask about vaccine passports. I know that WHO is working with Estonia on electronic vaccination certificates, and some European countries plan to implement similar vaccination passports as well. What would be the use of those if we don't know for sure whether the current vaccines prevent the spread of infections? And I'm going to ask the regional director to comment on that. Thank you.
Right. Proof of receipt of vaccination by any recipient is very, very important, be it on paper or digital, but of course we advocate for digital certificates, to monitor the coverage of the vaccination, to understand the effectiveness and the efficiency. But definitely we do not advocate for proof of vaccination against or for traveling, because that really would go against the equity, the fairness, particularly as there is a shortage of supply, and also still quite a number of questions related to the COVID vaccine. Thank you.
Thank you, Regional Director. Next, I'll go over to Ryan Thompson from CGTN Europe. Ryan, I believe you're joining us online. Please, your question.
Yes.
Thank
Hi
you.
there. My question is related to the inquiry being done by the WHO team in China. I'm just curious if you have any information about what's on the agenda now that they're leaving quarantine, or if it's not so much your domain, is there any directive from the WHO Europe team that they've asked them to take a closer look at or they would like to know?
Okay, thanks very much. As you're aware, of course, that team was not mobilised from this regional office, it was mobilised from our headquarters, but I will ask Katie if she would like to elaborate on any points that were advanced by and put forward by Ryan. Katie, thank you.
Thanks, Ryan, for the question. I don't have much to add at this stage. As you note, the team have completed their quarantine period that was required on entry into China, and they'll be taking up their field activities and meetings as we speak. We in the European region don't have any specific additional concerns or requests for the team. The deliberations have been planned for several months, and are fully confident that the team will do their job in the field. And we also anticipate with great expectation the results of the mission and following work that will follow up. Thank you.
And I'll ask the regional director maybe to add a point on this. Thank you.
Right, as Katie mentioned, indeed, this mission is not being organized from here, but indeed today, in fact, the 14-day quarantine finished. So the team will be leaving the quarantine hotel for another 14 days, a second time 14 days, because in Wuhan it's a rule of 14 plus 14. But during the second 14 days, the team will be able to go out under strict medical supervision, continuous testing, and the restrictive measures. A question I often get, but what about the last 14 days? So these 14 days have been well used because the team members have been paired by counterparts in China in different fields. There have been every day many hours of presentations and exchange of data. And the success would indeed be that there is a summary of all the data which are internationally available and available in China as well, but would not necessarily mean that the origin of the virus itself is really determined. It's very important also to know the intermediary host. In the case, for example, of MERS-CoV, after 1 year, it's still not clear what is the origin, but the intermediary hosts, like the camels, have been defined, and that's already very important to prevent and control outbreaks in the future. Thank you.
Thank you both very much. And thanks for those questions. I'll next go to Natalia Segura from the Catalan news agency. Natalia.
Hello. Good morning. Do you hear me?
We do. Please go ahead.
Okay, good. Yeah, I wanted to ask on Spain, the situation in Spain, because at the beginning you mentioned that currently there are 33 or around 30 countries that are getting better in terms of the number of cases right now. But it's not the case for Spain. I mean, like there has been still an increase in cases. So I wanted to know what is going on there, like if you're worried about the situation there, and especially if you think that there should be more restrictions or more measures to try to contain the spread of the virus. Thanks.
Thanks very much, Natalia. I'm going to pass that question over to Katie. Katie, please, would you like to respond to Natalia?
Yes. Can you hear me? Sorry, I had some trouble unmuting myself. Natalia, you're quite correct. So despite seeing really positive trends in more than half of the European countries in our region, we're seeing other countries that are still seeing very significant and increasing incidents. Spain is one, Portugal is another country that over the past couple of weeks has seen a very significant increase in cases. In Spain, we've seen high numbers, 200,000 cases nearly over the past week. And this is something to be particularly concerned about, given the widespread nature of that transmission happening across the country, but also posing, especially in larger cities, very significant strains on the hospitals once again. So there's certainly discussions around why that's happening. There's been discussions around the potential involvement of new variants of concern, although that doesn't seem to be necessarily driving the transmission in Spain at the moment. But certainly it could be a result of the post-holiday period celebrations that have taken place and will require a really sustained effort to bring the numbers down. It takes a lot, and it takes a lot of time to bring those numbers down. But over the past couple of days, we've seen new cases level off in Spain, and we hope that that will translate into a gradual decline in the coming weeks. But it does take time for those measures that have been introduced to take effect and to be seen in the new cases, and then slowly in hospitalizations, and finally in the deaths.
Thank you very much for the question, Natalia, and thanks for the response, Katie. Next, I'm going over to Sarah Nui from The Telegraph. Sarah, please.
Hi, thanks for taking my question. I want to go back to the row in Europe over vaccines. There's been some threats to introduce export bans on vaccines out of Europe. We've seen this in other parts of the world as well. Just wonder what the WHO makes of export bans in general and in the situation in Europe. Thank you.
Okay, Siddhartha, did you get that question? I think I missed part of it, but Siddhartha, I hope you caught it from Sarah.
I did also miss a few parts of it, but what in terms of, I understood that the question was around exporting a vaccine, but if that's correct, I don't know.
Sarah, can you just repeat? Sorry, you're a bit broken up.
I just wondered what the WHO make of export bans, especially because they've been discussed a lot in the last few days. What would you say in response to the suggestion that there should be export bans on vaccines coming out of certain regions?
Got it. Thanks very much, Sarah. Over to you, Siddhartha.
Yeah, thank you, Sarah, for that. So, what I would say is there are a couple of elements into that. We had been telling this COVID-19 vaccine is a global public good, meaning that the benefits of this vaccine should be made available to everybody in the entire globe, and any country or any population group should get access to it. Country irrespective of their income level, a population wherever it stays. So this vaccine, the benefits of this vaccine should be made available to everybody. We have heard earlier, and we all know about it, infectious disease know no borders. So whether you vaccinate only your own population and leave the other population behind or away will not solve it. So this access to vaccine should be made as a universal or a global commodity so that everybody can benefit from it. And if that is not being done, or that is not, there are obstacles being made around that, that actually will not help neither the country who is doing it nor for the rest of the globe. But the other part is around equitable distribution of the vaccine. We had been telling it, and I think it stays in its own context. Everybody should get access, and those barriers to ensure equitable and fair access of the vaccine should be this responsibility, a shared responsibility from everybody. And I think within the context of global solidarity, you have heard the regional director say earlier, but also ensuring that population groups anywhere, everywhere should get an access. Thank you.
Thank you very much, Siddhartha. Next, I'm going to go over to Stefano Valentino from the European Data Journalism Network. Stefano. Stefano, are you still with us? Okay, maybe while Stefano tries to connect, I'll go to Peter Kenny, who is from the Anadolu Agency of Turkey. Peter. Peter Kenny? No, I've lost.
Hello?
Yes, Peter, we can hear you. Please go ahead.
With these different strands to the vaccine conflicts that we've been having with the suppliers and the national concerns and regional concerns, what is there an element in this that concerns you about the degree of acceptance of vaccines by both health workers and the general population? And is there any indication that Johnson & Johnson, there's talk of Johnson & Johnson coming on stream, is there any indication that this will have any impact on the European region? Thank you.
Okay, so two questions there. The first was on vaccine acceptance, vaccine hesitancy. The second was on the Johnson & Johnson vaccine. I'm going to go to Siddhartha to comment on both of those, if you can, Siddhartha. I hope you captured that.
Yes, thank you.
Thank you.
Thank you for that question. So it's extremely important that the population for whom this vaccine is destined for accepts this vaccine. So hence the issue around demand and acceptance comes into the picture. Very, very pertinent question at this point of time. I think within the WHO regional office, this effort around vaccine demand, vaccine acceptance, vaccine hesitancy is one of the important elements, this immunization unit, and the all of office within the, an effort has been made also along the behavioral insights work of the regional office in its engagement with member states. What we have seen earlier part is around the people's perception about the vaccines, what we have heard in the media, also from the different studies and the surveys being done by the regional office. It showed people had hesitation in accepting the vaccine, or they will or may hesitate to receive the vaccine. The issues around that were around safety and efficacy of the vaccines when those issues were not known. So as a part of it, what did that tell us? This told us that the government, the partners, and everybody need to ensure that is transparency of this information sharing with the population groups. But because the first population group which will be receiving the vaccines are prioritized in the country are health workers, that provides a much more better emphasis on what needs to be done with this population group for a couple of reasons. Number one, they are both the recipient of the vaccine today, and they will be a provider of the vaccine tomorrow. So this is a priority group which should be provided all the information around safety, efficacy, and the quality of the vaccine. So because the uptake of the population groups for this vaccine will be dependent on the information they are being provided. This people's perception around this vaccine, we feel, is a sort of a health-seeking behavior of the population group. The better informed the population is, the better acceptance of the population for this vaccine moving forward. A very, very critical element beyond having a vaccine in a country. The second part of your question is on Johnson & Johnson. So we do appreciate and acknowledge and recognize the effort made by different vaccine platforms, different vaccine manufacturers, to the effort being made in the last 1 year since the detection of the virus. At this point of time, as the Behavioral Insights Group and the surveys that are being conducted is around vaccine, COVID-19 vaccine as a whole. We haven't seen any vaccine product-specific hesitancy or people's perception around that topic. But I think this topic has to be, it should not be a one-time snapshot. The people's perception change. We have seen that in the routine immunization program across several countries in our region. And I think we should be doing this together with our member states. WHO Europe is engaged with the member state to learn further what's happening in the population groups, and we'll be very much happy to share those information as we learn further from the ongoing surveys that WHO Europe, the Behavioral Insights team, and the immunization team together is doing with our member state on this topic. Thank you.
Okay, thanks very much, Siddhartha. I've got time for a couple more questions, I hope. I'm going to go over to the Times of India and to Ashvin Bashinge. Ashvin, the floor is yours.
Yeah, thank you for taking my question. I want to just correct it. Ashwin from Observer Times. My question is, what efforts WHO Europe planning to develop and encourage pandemic emergency facilities around the Europe? Thank you.
Pandemic preparedness facilities, preparedness, I'm going to ask Katie if you could possibly please comment to that. Did you catch the whole question from Ashvin?
Rob, I'm not sure I fully captured it. Perhaps he can repeat the question.
Please, Ashvin.
Yeah, sure. What efforts WHO Europe planning to develop and encourage pandemic emergency facility around the European countries?
Okay, thank you very much, Ashvin. Perhaps I can talk a little bit about the work that we're thinking about 1 year into this and the lessons that we've had from the pandemic and how that's going to impact the way we work with our countries in the European region. When we're talking about pandemic emergency facilities, I think what you're referring to is the country's abilities to put in place programs for pandemic preparedness and pandemic response. And here, building on the establishment of the WHO Emergencies Program in 2016, we'll be taking a very long look at how this has been done in the European region and what are the big lessons that have come out of COVID-19 that we'll need to include into our pandemic planning for the next pandemic, which will happen in due course. We hope it won't happen soon, but as we know, these types of events may be occurring more frequently in the future. And this is something that we have included in our programming. We will be discussing with the involvement of all of the international review committees that have been set up around COVID-19, as well as our work doing interaction reviews with our member states in the European region during the course of the pandemic to make sure that any innovations that have been identified during COVID-19 can be institutionalized into the national programs for emergency preparedness and response. Thank you.
Thank you very much. I'll ask the regional director to maybe add a few points.
Yes, but really complementary to what Katie was telling. So, Ashvin, there is a new center now in Istanbul, supported by the Turkish government, which is called a GDO. It's a Center of Excellence on Pandemic and Emergency Preparedness. And that will serve the 53 countries in the region. So that's really an additional resource that is available to the countries in the region, number one. And number two, in line with what Katie was telling, we are also consulting Minister of Health, Finance, Heads of State, under the umbrella of the Monti Commission. For example, we had the very good conversation with the Minister of Health of Portugal. Portugal has the EU presidency now, and we're looking at possibilities to table this question at the joint meeting of Minister of Health and Finance. The same for the Turkic Council, which will have a summit end of March, as well as the Eurasia Economic Union. Thank you.
Great, thanks very much. So I will try Stefano Valentino one more time from the European Data Journalism Network. Stefano?
Hello, how? Hey, can you hear me now?
We can hear you. Please go ahead.
Can you hear me?
We can.
Yes. Thank you for taking my question. It's a follow-up question in regards to the shortage of vaccine supply. So I would like to have a clear answer from Director General Mr. Kluge, yes or no, to the following question. So you think that to face this shortage of supply, you think that it's high time for a community to adopt a global agreement providing binding rules for pharmaceutical companies to share clinical data, know-how, technology, and intellectual property to enable third-party manufacturers to produce the vaccine and have more doses for everyone instead of relying only on the limited capacity of pharmaceutical companies, which are really showing that they cannot meet the demand. Yes. Yes or no, and please in the comment if you want, if you can. Thank you very much.
Thank you, Stefano. You know, this is in principle nothing new, Stefano. We had a World Health Assembly resolution on this, on transparency, including on the pricing of pharmaceutical products. And we in the region are taking this forward to the Oslo Medicines Initiative. So transparency is very, very important, Stefano, and there are different mechanisms working on this. Thank you so much.
Thanks very much, everybody, for joining us today. We're at the top of the hour. Very grateful you could join us. We'll be back in a couple of weeks' time with another press briefing. Please be aware that the statement, of course, will be posted online. I thank you for joining us. I'm sorry I couldn't get to 2 or 3 of you, including Bin Chen from Shanghai Media Group and others. Please send your questions to us in writing. We will try and respond as quickly as possible. In the meantime, take very good care of yourselves, and we will see you again soon. Thank you.